Welcome to the office.
Hi.
Hi.
How's it going?
Good.
Welcome back.
Thanks.
What are you doing?
I'm okay.
What'd you come for?
My back. My lower back.
Okay, we've had a couple visits.
Right.
Okay. Jokes aside. How did you do with your first two visits?
That was good. I felt really good after the first two.
What's
I don't
different?
know. Oh yeah, for sure.
What's different?
I was able to like bend over. I was able to pick things up. I wasn't like just in pain. Like when I would just stand,
Yeah.
I would be in pain. When I would sit, I would be in pain.
You're
I'd
too
be in
young
pain.
to be
I know.
How'd you get all that?
I was in a car accident. I got rear-ended on the
That's
freeway.
right. Yeah. That was when?
September?
Last year?
Yeah.
So it was recent.
Yeah.
And you had some treatment done?
Right.
And
Nothing worked.
nothing really. Alright, so the two adjustments, you got a little relief.
Right.
Okay.
Yeah. A
Yeah?
lot of relief, actually.
30, 40%, 50%?
I would say so.
Okay, cool.
Mm.
And what sport are you doing?
I just weightlift.
Okay. Did you weight lift?
I didn't.
Body weight?
Yeah, resistance bands.
Okay.
A lot of walking.
Alright, it's good. So Gabriella came, her dad brought her, right? Your
Yeah.
dad was the one who found me on YouTube and brought her in, and she did have a few things going on, and we started obviously on the tailbone is what we found.
Right.
And why don't we see where we're at today?
Okay.
Overall, you're doing good. Did anything new show up?
I feel like the last 2-3 days, my back was acting out like the way that it used to, which was kind of new.
Okay.
Being so used to feeling almost all better.
Hold on. So it started to feel like it was pre-accident?
No. Pre-you.
Oh, okay. And did you stop the habit?
The habit.
Meaning we started to change some habits and said you need to. Sorry, I'm not fun with the boat. We talked about the walking.
Right.
The no weights,
Right.
the icing, you're
Right.
doing all
All
that
that.
stuff. Sleeping, everything else is the same. No new variables.
No.
Okay,
think
no
so.
problem. Let's take a look. Do you have any questions for me?
I don't think so.
Let's get started. Starting at the base of the neck, let's see what we got. And first thing we're getting, base C6, C7. How was the drive today?
Long.
Hour and a half, hour?
Yeah. We came from the beach, so it wasn't too bad.
Oh, cool. C6, C7 left, C1 right. T6, 12 points. Let's make that T. Nope. Watch this, guys. This was good. So it looked like it was breaking, but if I keep going, it didn't stop. It didn't stop yet. It didn't stop yet. Stop there. So it's doing this.
That's fine.
The meter. So it's a little misleading. A lot of this is muscular right now. Didn't stop. Didn't. Oh. Forget that one. I'm gonna go with that one, and she has a pimple right there, right near the spine.
Oh.
And anytime we see a pimple on the spine or near the spine and it's something new, you can even see one starting there, something's gonna show up there.
That has something to do with the.
It's one of the stop signs. It's the body telling the chiropractor where to go. And we're higher up in the tailbone now, around S2, 10 points. Never mind, it kept going. You got a lot of compensations today. So I thought it was there, it ended up being there. I thought it was there, it ended up being there. What does that mean? That's what I want to know. Head down, please, round your back. How's school?
I'm on spring break.
Yay. 7, 3, 4, 5 or 6? 5 or 4? Neither.
5.
5. Oh, we're gonna have fun today. 12.
Sorry.
That's all right. 5 I got off palpation. 12. Let's check down low. Come back slowly towards me, please. What?
It hurts.
1. Tender.
Yeah.
2. Tender.
Yeah.
3. Tender. 4. And 5. Not too bad at 5 now.
No.
That's 4.
Mm.
Starts now.
Yeah.
3. Okay, so we're moving on up. 3, 12, 5. Let's check it. Sit back for me, please. All right, so we're gonna do S3, left side down. Then we're gonna do T12, T5, and then we'll check the neck after.
Okay.
Because there's too much shifting going on in your body today. It's not a bad thing. It's just a little misleading. So I know if once I set those at the bottom, something else is going to show up in the top. So let's go ahead and start with your tailbone.
Okay.
Cool?
Cool.
Right side down, please. Gotcha.
It didn't hurt, but it didn't feel
That's
great.
right.
Yeah.
Come on up.
Oh.
Gotta move that bone, girl.
Oh, man.
Walk it out.
Okay.
Walk it out.
Mm-hmm.
Walk it out.
Sure.
So we got 2 knee chest tables out here today, guys. We're gonna use the lighter one for Gabriella. The angles are a little bit different. You can see both of these knee chest tables. The one I normally use, it does have a wider base than this, but on the first setting, you can see this one is higher. The angle is a little bit up. This angle goes down a tiny bit. So she'll be able to get a little more extension on this one. If I put her on this, let's test it, just so we can show people. So different knee chest tables, people respond, or different people position differently. So let's go on this one first. And have I showed you this yet? Okay, so the way we get on the knee chest table, and it's called the knees because we're down on the knees and we put our chest down. So the knees go down like this. We bend at the hips 90 degrees, this way. Chest to the chest piece, face down. There should be a 2-finger clearance, 2-finger clearance for the throat. And the knees are slightly past 90 degrees. And then we just let the belly button hang. Okay?
Okay.
Now watch me in this position.
Mm-hmm.
Now I'm gonna go on that table. Same, it's the first position of the slot. Look at how different I sit on this. You see how I can get more extension in my low
Right.
back? That one's higher, so I can't
Back's
do it.
less arched.
Correct.
Okay.
Now, let's have you go there first. Cool? Just so we can get the position first. Go face down, bend at the hips. And what I want to see, knees forward a little bit. Okay. Knees together a little bit. Tummy down all the way. Arch. So this is where she's at. This is the bottom here. This is the top. You want to have the contact point. If we're adjusting L5, L5 needs to be the higher point. I can adjust this table and bring the whole thing down, but then it'll be too steep for her. So let's go on to the other table. You felt that?
Yeah.
Cool. Now go here. Bend at the knees slightly forward, tiny bit. Tummy down. You see how you can arch more?
Yeah.
This one is more comfortable, yes?
Yes.
Cool. You ready?
Mm-hmm.
Cool. 5, 4, 3, 1, 12. I'm gonna do a thumb piezoform, drop it down.
God.
Gotcha. I know. Come on up. Let's spice it.
Oh man, that didn't feel great, but
Wasn't that great?
yeah, it was great.
It was great.
Go all the way up.
Come on up. Walk it up. That was deep.
Yeah.
But watch how that's going to get you up right now. Watch. Keep walking. One more time. Feels different, yeah? A little different?
Yeah.
Face down. You're funny. Slide up. That's the home run. Oh, yeah. You're laughing?
Yeah.
Okay, good. Deep breath in. Look at how she's sitting, dude. Check that out. Look at that. Perfect. Feels good, right? Perfect. Muy bueno. Muy bueno. Get down. That cleared the base of the neck, but the top is still there. Let's do the top. Sit back for me, please. All the way back. Left ear. Left ear down. A bit more. There's the rest. Now it should be a double funk. Perfect. Go on your back, please. Yeah.
Whoa.
All right, so I think I'll see you if I can one more time before I head out back to Dubai.
I think we have it in the schedule.
Saturday, right? On the weekend?
Or Friday.
Friday or Saturday?
Yeah.
Okay, that's good. Cool. See, you could get away with these socks if you take a white out and put right R and L. Then it would make sense.
Okay. Next time.
Okay, sit up and turn, please.
Okay.
Jokes aside. I'll go upstairs. Center up on the chair, please. Sweet. Do you have any questions for me?
I mean, I feel like well, no, you did do my lower back.
You
That was the first thing you
understand everything I'm doing with you now.
Yeah,
You
yeah.
understand what's going on with the spine,
did.
right?
100%.
And what's different here for you compared to what you've had?
Everything. Well, first you actually looked at my body from like an x-ray, and then you explained it to me, and it actually makes sense, and I can see it too, and it feels good. Like it makes a difference in how I feel, so.
Good. And whatever happened, there was a lot of stuff going on in your body today. Just please can make sure you're doing your walks, you're icing your ball, okay?
Yeah.
That's it. And sleeping is okay?
Yeah.
Okay.
I'm wondering, is there anything else that could have like caused it to act up?
I have no idea, dude.
Just anything out of the ordinary, don't
Yeah,
you?
that's why I was asking if
Right.
there's any new variable,
But,
but there wasn't.
okay.
Clarissimo. Let's work on the shoulders. Let me do it. Let me do it. That's it. On your back.
Sorry.
Awesome. Sit up and turn. Let's buff you out. Cool. get through this week, next week we can start light weights and get back into it, okay? That's as long as I see your posture like this next visit, because today's looking perfect.
Okay.
Did we talk about standing on one leg?
Yeah, balancing?
Yep.
Yeah.
You doing that too?
Yeah.
Perfect. Cool. Stand up on please. Squeeze the hand. Squeeze. 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 A little bit on the elbow. Squeeze. That was a lunate. Squeeze. Squeeze. A little bit on the scaphoid. Still right there. Dirty. Squeeze. Firm. Squeeze. Squeeze. Squeeze again hard. Good. Squeeze. You're all set.
Thank you.
You're welcome. I'll see you in a week.
Okay.